Hi, everyone. Today, we're diving into a fascinating topic: how EEG neurofeedback and acupuncture can help treat stroke. Dr. Melinda Lay possesses extensive experience in treating depression at Yanhuang TCM Clinic in Silicon Valley, California, utilizing a unique combination of EEG neurofeedback and acupuncture. Over the years, she has honed her skills and expertise in these methodologies, providing a comprehensive approach to treating stroke. A stroke, also known as a cerebrovascular accident, occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting enough oxygen and nutrients. There are two main types of strokes: ischemic and hemorrhagic. An ischemic stroke is the most common type of stroke. It occurs when a blood clot blocks or narrows an artery leading to the brain. There are two main types of ischemic strokes: a thrombotic stroke, which occurs when a blood clot forms in one of the arteries supplying blood to the brain, and an embolic stroke, which occurs when a blood clot or other debris forms away from the brain, commonly in the heart, and is swept through the bloodstream to lodge in narrower brain arteries. A hemorrhagic stroke occurs when a blood vessel in the brain bursts, leading to bleeding, hemorrhage, in or around the brain. There are two main types: intracerebral hemorrhage, which is when bleeding occurs within the brain tissue itself, usually caused by high blood pressure, and subarachnoid hemorrhage, when bleeding occurs in the space between the brain and the thin tissues covering it, often due to a burst aneurysm. When a stroke occurs, it affects various parts of the brain. Let's understand the effects based on brain regions. Frontal lobe. A stroke here can cause weakness or paralysis on one side of the body, problems with thinking, speaking, and judgment, and changes in behavior and personality. Parietal lobe. Damage can result in difficulties with spatial orientation, recognizing objects, and processing sensory information. Temporal lobe. A stroke can affect memory, speech, and comprehension. Occipital lobe. Vision problems, such as partial or complete blindness, can occur. Cerebellum. Coordination and balance issues, dizziness, and problems with fine motor skills are common. Brainstem. Strokes here can be particularly devastating, affecting basic life functions such as breathing, heart rate, and swallowing. It can also cause weakness or paralysis on both sides of the body. Symptoms of stroke include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause. Now, let's talk about how EEG neurofeedback can be beneficial for stroke rehabilitation. EEG neurofeedback can help in several ways. 1. Improvement in motor function. EEG neurofeedback promotes neuroplasticity, helping stroke survivors regain motor functions by forming new neural connections. 2. Enhancement of cognitive functions. It can improve cognitive abilities like attention, memory, and executive functioning by training specific brainwave patterns. 3. Emotional and psychological benefits. EEG neurofeedback helps regulate brain activity linked to mood, alleviating depression and anxiety. 4. Reduction in spasticity. By training the brain to better control muscle movements, EEG neurofeedback can reduce spasticity. 5. Individualized rehabilitation programs. EEG neurofeedback allows for personalized rehabilitation tailored to each patient's brain activity patterns. And 6. Complementary therapy. It enhances traditional rehabilitation methods like physical, occupational, and speech therapy. EEG neurofeedback measures brainwave activity through electrodes placed on the scalp. This activity is translated into real-time visual or auditory feedback. Patients learn to control their brainwave patterns, leading to changes in brain function and behavior. By leveraging the brain's ability to adapt and change, EEG neurofeedback offers a promising avenue for stroke rehabilitation, enhancing both physical and mental recovery. To complement regular EEG neurofeedback sessions, Dr. Lay also recommends acupuncture. Traditional Chinese medicine, TCM, explains that a stroke disrupts the flow of qi, or vital energy, and blood in the body's meridians. This disruption can cause symptoms like paralysis and numbness. Acupuncture helps by unblocking these meridians, restoring the normal flow of qi and blood, and rebalancing the body's yin and yang energies. Specific acupuncture points, such as Bai Hui on the head, Kuchi on the arm, and Zusanli below the knee, are targeted to improve motor function, reduce pain and muscle stiffness, enhance cognitive and speech functions, and support emotional well-being. Dr. Lay's team aims to support individuals recovering from a stroke with EEG neurofeedback, combined with acupuncture. They are committed to providing assistance to people worldwide who are affected by this condition. Their goal is to enhance the overall well-being of those recovering from a stroke. Through their dedicated efforts, they hope to make a significant positive impact on patients all over the world.